Everyone, I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. When you entered the webinar tonight, I purposely have everybody muted, but I know some people have unmuted yourself. So my request is please mute yourself so that we don't hear background conversations going on in your room. Okay, that'll just make it easier for all of us here tonight. It's good to be back with you here. I was gone last week. I was actually talking to a group of Amish healthcare professionals in the middle of Berlin, Ohio, somewhere between around Akron and Cleveland. It was an interesting gathering, and I enjoyed being there, but I also missed being with you all too. So we have a webinar tonight. I am going to be at another meeting next week, so I won't be able to do it next week, but the week after that, I'll be back with you again too. So I apologize. April's a little sparse with my webinars, but I've been out there trying to educate other people as well too. So tonight, I have an hour and a half with you, and I'm interested in hearing what questions you have in store for me. The way this works, I have you write your questions to me using the chat box. That way we can get through more questions. I will answer that question, and then I will take additional questions about that question. Okay, so I want to be clear. When I say it's time to ask a question about what we just talked about, it's just about that. So it's not time to jump in to questions that you're hoping I'll answer later on. Okay, so I just want to be clear about that. And then, as usual, I am creating and recording tonight's webinar somewhere in the morning around 9 to 9:30 a.m. Central Standard Time. I'll have it all posted up in the Zoom recordings area at Lyme United, so you'll be able to watch those as well too. And I do, as you all know, I highlight those so that they are tied to bubbles on the video screen, so you can kind of tap around and see what the topics are based on how I list them out as well too. All right. So without any further ado, let's go ahead and get started here. One other thing, it hit 90 degrees in Austin today, which is why I'm sitting here in my Hawaiian shirt. It seems to be a little early for this kind of temperatures, but here we are. All right. So let's go with Kelly first. Hi, Kelly. Hi, Marty. Hope you're doing all right. Recently did the Radiance COVD long hauler cytokine test and review with my immunologist. He said it was unusual that my TNF alpha is low, while several other indicators are suggesting inflammatory and overresponsive presentations. For example, my SCD40L at 9,842 and CCL5 at 12,971. Do you have any thoughts about this? He also said a lot of autoimmune conditions suppress TNF alpha, which seems consistent with the many symptoms I have. If I already know something is going on tick-wise, MCS, and likely mold, is that enough to explain this, or should I be concerned that I may be in the prodromal stage of some sort of autoimmune disorder? All right. So this whole Radiance COVID long hauler cytokine panel was developed by a physician named Dr. Bruce Patterson. And I still think we're all trying to figure out how to work with it. I mean, he claims that there are some cytokine patterns or fingerprints that would be consistent with long Lyme, and that there are other ones that are consistent with long COVID. And I think that I think the jury's still out on his panel. I worked with it for a bit of time when I was still practicing in Seattle, and I found that it was giving mixed results. I found that there were a number of people that it would suggest long hauler and they would get on his protocols and they did not get better. There were some that did get better. I think it's a mixed bag, basically. I do agree that TNF alpha can be suppressed in some autoimmune illnesses, but that does not prove you have an autoimmune illness either. And so basically, the approach that I would do is, Kelly, would be to still keep treating your various inflammatory disorders, which would be if you have the tick-borne infections and you have mold toxicity, keep focusing on those, and using your binders, using your germ killers, being on things that lower cytokines like liposomal glutathione, being on curcumin, but pursuing all of those steps, basically. That's the best I can say to do here. The other thing you may want to consider in terms of if you are stepping into autoimmune illness would be to consider doing two things. One is low-dose naltrexone, and the other one is a way of raising your thymus gland protein or peptides. Okay, So there is a low-dose naltrexone and um, Thymus bioregulator. Thymus bioregulators are short peptides that talk to your thymus gland and tell it to work better, basically. And there is a product called Thymogen Alpha 1 made by Integrated Peptides that has two thymus gland bioregulators. That product, along with low-dose naltrexone, when you take them, can create better harmony in the various aspects of the immune system. So there is something we call Th1 inflammation. I'll explain what that is in a minute. There's something else called Th2 inflammation. There's something called Th17 inflammation. And then there's a group of cells that regulate these kinds of inflammation, and those are called T regulatory cells. All right. So what we want to do is get more T regulatory function to balance Th1, Th2, and Th17. All right. Th1 is your immune cells that attack germs. Okay, they're T white blood cells, some natural killer cells. All right. Th17 are also cells that fight infections, but they fight new infections that your body has not learned how to make Th1 cells to yet. Okay, there are groups of white blood cells that sit underneath your skin, along your mucous membranes in your lungs and in your nose passages, and they're set up to catch anything fresh that comes through that your immune system has never seen. All right. Th2, what that is that is your white blood cells that make antibodies. It's also your mast cells that get turned on when you have allergies. Those are the main components of Th2. It is thought when you have autoimmune illness that it's due to too much activity of Th1 and Th17. Okay. So autoimmune means that you've got too much activity of your germ killers. It doesn't mean they're working well at killing germs, but they're too ramped up. And so what we want to do is get them balanced down. And to do that is we work with the parent in the room, the parent that's in charge of how much activity all these kids have, the Th1, Th2s, and Th17s. And what can raise T regulatory function is to use low-dose naltrexone, or to use this peptide bioregulator complex called Thymogen Alpha 1. Is designed as it has two thymus bioregulators, and as by turning on the thymus gland more, it can turn your Tregs on more too. Okay, so those are the two products. All right, if you to use that Thymogen Alpha 1, you would wind up working with it at one pill twice a day. That's the recommended dose. Low dose naltrexone is something, what naltrexone is it is a medicine that would have to be compounded. Naltrexone at full strength is designed as something to help people with addictive disorders. But when we use it to regulate your immune system, we use it at really low doses, which is why it's called low dose naltrexone. All right. And that one, I usually start at 1.5 milligrams daily for 2 weeks. Then I increase it to 3 milligrams daily for 2 weeks, and then I go up to 4.5 milligrams. Now, I can show you an article here in a minute that covers both of these bioregulators and the LDN, but that's generally how I would pursue something like this, is make sure you keep treating your infections, your mold toxicity, be on your curcumin and your liposomal glutathione to help lower inflammation, and then do something to turn on more of your T regulatory cells. Okay. All right. So Kelly, do you have any questions there and follow up to that?
Hi.
Hi, Kelly.
That was great. I was taking copious notes. So I have my second meeting with a holistic psychiatrist on Monday.
Oh,
So I'm
good.
thrilled to touch base with you first and feel reassured, because her little hint of what she might do for treatment planning at the end of our intake, she did reference LDN, which I've been
Yeah.
hearing about.
Yeah.
So that's good to know. And do you typically, like, for the other one, the bioregulator, does that
Yeah.
usually need to be
Yeah.
taken with LDN?
You could
Is
do
it
both. You could do both. I
okay?
mean, or what you might want to do is pick one to go with first, get on it for
Yeah.
a month or two, see if you're getting enough benefit out of that. And if you are, don't go with the second one. But
Yeah.
there's also no harm in doing the full court press, if you will, and
Yeah.
starting with your thymus bioregulator peptides, as well as doing LDN at the same time. One
Yeah.
thing about LDN, although it generally has minimal to no side effects, it rarely will have some neuropsych side effects. And I know you have psychiatric issues. So you might, as you're trying to figure out whether you're going to be able to tolerate it, you might want to start one at a time. The most common effect that people can get is insomnia, and for that reason, I have people take it in the morning. Some doctors still tend to prescribe it at nighttime under the belief that that you get better benefit that way. I don't think so. Okay, so I usually tend to dose it in the morning, basically. But because of a rare neuropsych side effect that I see with LDN, you might want to start it separate, at least for a week or so, from doing the thymus bioregulator, so you can tell where your reaction is coming from if you get one.
What would this rare side effect be?
It's a whole host of things. I mean, it's not, I would not say there's a typical thing. I
Yeah.
sometimes see people get some confusion out of it.
Okay.
Rarely. Okay.
Okay.
I have not seen anyone get depression out of it. I had one person that got some agitation out of it.
Hmm.
But again, that's one person of, hundreds of
Yeah.
people I put on it. So it's a rare
Okay.
thing to see. Yeah.
Okay.
All right.
Thank you.
All right, let me just do a screen share here and I'll show you the article that kind of covers both of these. Right, so let's see, T-regs or T-regs. It would help if I can spell. There we are. So it is, oh, let me do something here. I got myself set up wrong. Let's try this again. Okay, so it's this article, boost Tregs to balance Th1, Th2, and Th17. Okay, all right. And in here, I describe, there's a video. I also describe working with LDN and this product called Thymogen Alpha 1, which is a thymus gland bioregulator. Okay,
Thank you.
you're welcome. In that article, too, I do link directly to a whole article I wrote about low dose naltrexone as well too, so that you can get more detail about low dose naltrexone that way too. Okay.
Okay,
All right.
great.
All right. All right. Does anyone else have a follow-up question to Kelly's on that topic? Nothing new, but just on that topic. All right. Let's move on here then. Let me see. Nope. Okay. All right. So, all right. Hello, Trish. Let's see. What is this almost constant buzzing in the feet? It's especially worse after a hot bath or sauna. This has been never ending, even with doing protocols or not. Also, methylene blue. I know you have to test for the gene. I was tested a year ago. Now I'm back on a new protocol with methylene blue. Does this gene need to be tested periodically? Thank you so much. All right. So, buzzing in your feet is a symptom of neurologic agitation. Okay. And it could either be your peripheral nerves and your feet are agitated, or it could be coming from agitation at the level of the brain, signaling all the way down to the feet. Um, and so it's part of neuropathy, basically. All right. And so that neuropathy could be coming from your tick-borne infections, which is either Bartonella or Borrelia. It could be part of mold toxicity. In terms of things that I suggest that people do when they get that, if they've been doing their germ killers or they've been working with their mold toxin removers and also using your curcumin to lower cytokines and using glutathione to lower cytokines. But if you're still having a lot of buzzing, then there's a couple things that you could do, and this is more oriented towards repairing nerve injury. So the other things I was talking about is removing the insults, but you can actually get into nerve repair. And two parts of neurologic repair is to use glutathione. Liposomal glutathione is a very powerful antioxidant. Your nerves and all of your cells use it to repair injury, and your nerves, especially if they've been trying to repair damage, they may have exhausted their glutathione supply. So sometimes filling that glutathione gas tank back up, if you will, with liposomal glutathione. For that, I like the Trifortify product. The reason I like it is they've got science showing it's actually absorbed. Okay, that's the problem with glutathione. But glutathione, I would do a teaspoon once a day. The other thing I would couple that with is something called ATP 360. And ATP 360 is a product that is made by Research Nutritionals. The key ingredients in it are a phospholipid mix of fats that make up your nerve cell membrane and also the covering of your energy factors in your cells called mitochondria. The other key products in there are a bunch of nutrients that help mitochondria work better and something called PQQ that helps increase mitochondrial mass. It causes mitochondrial biogenesis. Anything you do, whenever you have nerve injury, it automatically means you probably have mitochondria injury. Secondly, the fats that make up the mitochondria membrane that get repaired by ATP 360, also those same fats repair the membranes of your nerves as well too. So a typical protocol that I would do would be liposomal glutathione, a teaspoon a day. And for that, I like the Trifortify product. And then I would use that ATP 360 as 3 pills 1 time a day. An additional way to approach it, if you're already doing that and not getting anywhere, is to consider adding in a peptide, which is BPC 157. And BPC 157 is a peptide that occurs naturally in our stomach. In our stomach, it's designed to help make and keep the intestines working well. It was noted by athletes eons ago that it helps repair musculoskeletal injuries, and most of us find it also seems to be helpful with neurologic injuries as well too. So you could do a BPC 157, and you would want to do it as a 500 micrograms or 1 pill twice a day would be a way of doing that. Okay, so that would be my approach: is deal with your underlying infections, which you probably are doing already, deal with your toxicities, and then if you need to, get in there and start trying to do some neurologic repair. Regarding the methylene, the test, the G6PD test, which is to see if your body is going to be able to handle the methylene blue and make sure that you don't hemolyze your cells by being on it, you only need to do that once. Once you've established that you have adequate levels of the G6PD, you do not need to come back and test it again. Okay? All
Okay.
right. Yeah.
Thank you.
Yeah. So do you have any questions there, Trish?
No, I'm good. Thank you.
Okay. Good luck to you.
Thank
Does anyone else have follow-up question to what Trish and I were just discussing there? Okay. All right. Hello, Jim. Let's see. Hello, Dr. Ross. Thank you for offering these sessions. You're welcome. Let's see. I have learned a lot from you and the larger community over the past few months. Good. Good. I'm glad to hear that. Wife is diagnosed with ALS in November 24. We're able to get an IGeneX TBD4 test through a functional doctor in December 24. The results were positive for Borrelia and European strain, I think is what you're, Borrelia US and European strains, a tick-borne relapsing fever, and Babesia decani. Her FD, a functional medicine doctor, started her on doxycycline, Plaquenil, and Mepron, as well as low-dose naltrexone, serapeptase, Trifortify, and orthobiotic. She tested positive for mold mycotoxins through real-time lab in January of 25, trichosethines, gliotoxin, zero known. Her condition worsened during the past 3 months despite the treatment. She started IV ceftriaxone 3 weeks ago, but has continued to decline and essentially bedridden and can barely speak. Thank you for your consideration. So, Jim, I'm sorry to hear this. ALS, even if you can identify that you may have infectious causes or infectious contributors, or mold toxins that can be contributing, it's a tough condition. I just have to acknowledge that. And you know that. I mean, you're living it with your wife right now too. So what I see in my practice when I was treating what I would call severe neurologic syndromes related to tick-borne infections and mold toxicity and that would be things like multiple sclerosis, ALS. So we think MS and ALS can either be caused by tick-borne infections, or they can be exacerbated. And that's the issue, is we don't know when you have tick-borne infections thrown in, are they the cause? So what I found in my practice is in treating tick-borne infections, I was able to help 25% of people get recovery from the neurologic syndrome. Okay, like better, they improved. Okay. There was 50% of people in my practice that I found I was able to help them with their fatigue, their body pains, but I was not able to do things with the underlying neurologic complex of symptoms that they had. And there was another 25% of people in my practice that I got no improvement on anything. And I don't mean to be a downer here, but I just want to let you know what my experience has been working. This is just a tough illness to do. Okay. So I understand she's getting worse, and I'm sorry to hear that. So this just could be a progression, and it may be that you're not going to be able to do anything with the kind of treatment you're doing. Or there may be still some tweaking that you can do. Okay, so let me just look at what you got here. So she's on with the ceftriaxone that was added in 3 weeks ago. Is she on any other antibiotics at this point, or is it just ceftriaxone alone?
So she stayed on the existing regimen. She remained on doxy with
Okay.
So
Okay. So just quickly, the Babesia decani, I know that IGeneX said she had that based on testing. The problem is so that's measuring antibodies against this strain called Babesia decani. There's a lot of cross-reactivity between Babesia decani and another strain of Babesia, which is called Babesia oticoli. Babesia oticoli, if she were to have it, and having a decani test that's positive, there's a possibility it's really oticoli, is what I'm trying to say. So that is a more difficult to treat strain of Babesia. And most of us are finding a better treatment for it to be using a medication instead of Mepron called tefenoquine. And then taking that tefenoquine along with Mepron. So it's a tefenoquine plus Mepron, and I would get rid of the Plaquenil. So in terms of where you may tweak this a little bit in terms of a stronger Babesia treatment, because there is a possibility that this is decani, okay, is to go with the tefenoquine along with the Mepron, okay? And then the other thing I'm a bit concerned about here is I know that she did not test positive for Bartonella, but we know she's got 2 strains of tick-borne infections. All right. And we know we don't have studies that tell us from across the country, but East Coast studies tell us that about 75% of ticks that carry Lyme carry at least 1 co-infection, and 55 to 60% will carry at least 2 co-infections. Of all of the tick-borne infections that are known to give severe neurologic issues, Bartonella tends to be the lead. And so I would want to be considering here what to do about Bartonella as well too. Now, what you might want to talk with your functional medicine doctor about is you could turn this treatment into a Bartonella treatment, leaving her still on the doxycycline. Your ceftriaxone is only going to go after neurologic Lyme. It's not going to do Bartonella. I just want to be clear about that, okay? But you could leave her on the doxycycline, which is also helping the Borrelia. And then doxycycline is part of a Bartonella treatment, and you could add in compounded methylene blue. Now, what methylene blue does is it's a pill you're going to take, but even as a pill, it's very fat soluble, so it crosses over into the brain quite easily. It crosses the blood-brain barrier into the spinal cord, into your dorsal roots there, and so what that does is it goes after growing Borrelia and Bartonella, and it goes after what are called hibernator or persister states of Borrelia and Bartonella. Your current treatment right now is oriented on the Borrelia side to just going after growing. It's not doing anything about persisters, okay? And so there's two tweaks I think I would do here. I'd probably get three. I would get rid of the Plaquenil because you don't need it for the Bartonella, okay? I would probably add in the tefenaquine, keep the Mepron going. That gets you much stronger on the Babesia side in case you've got some Oticoli here, okay? And then to get at Bartonella and to get at persister Lyme and persister Bartonella, consider adding in methylene blue. Given her neurologic condition, I might start at 25 milligrams twice a day. And if she seems to tolerate that, I would then go up to 50 milligrams twice a day. Okay. On the tefenaquine side, you can either get it as a 100 or 150 milligram pill. Given the neurologic situation she's in, I tend to start lower. I would either start at 100 or 150 milligrams a day. And once she seems stable on that, then I might go up to 200 to 300 milligrams a day on that. Okay. And you can read about, I'll show you some articles you can look at here in a minute. My whole methylene blue article, my article about Bartonella treatments, and my article about Babesia treatments, where you can find these various dosing recommendations to show your doctor as well too. Okay. So those are some thoughts. You just may not have it tweaked enough yet to get at the full germ complex that's going on here, especially if she's worsening. I have to wonder if something is missing germ-wise, and that means the Bartonella. I know if this is Oticoli she has, that's a weaker treatment. Even though she tested for Thymus, again, it may be Oticoli because there's cross-reactivity in the way that this is working, okay? And then I didn't mean to rain on your parade, but I just have, raise the specter that this is a tough condition to treat. So, yeah, okay. Any questions there?
Well, I mean, with ALS, as you well know, it's a clinical diagnosis. It's entirely based on physical exam and EMG, et cetera.
Yeah.
Any possibility this could be CIRS masquerading as ALS, CIRS, chronic inflammation?
Yeah. No. So the thing is, basically with the you've got the dorsal root ganglion, which has been affected here, and ALS actually, it basically is not working correctly anymore. That's going to be picked up by the EMG. I have not seen that extreme of a presentation occur in mold toxicity alone. I just haven't seen that happen. Now, could it? Maybe. I just think it seems extreme for mold toxicity.
She got this all right after COVID. So her ALS presentation was she got COVID and within days lost feeling on the left side of her body. And so it came on in two limbs very suddenly. It's a very unusual presentation of ALS.
Yeah. I mean, I think any neurologic condition, they're all basically diagnosed by checking off boxes on a list. There isn't a true test that proves it's ALS or MS. Like an MS, we look for certain types of lesions in the brain on an MRI, but seeing those lesions doesn't tell us what the cause is, right? Same with the ALS, and that's the frustrating thing is neurology works in syndromes, but neurology can't tell you the causes. They just don't know with a lot of these things sometimes. And it may be that she's got a very complex number of contributors that are causing her dorsal root ganglion not to work correctly, right? It could be the accumulation of everything, tick-borne infections, toxicity, damage from COVID. I mean, it could be all of that stuff working together, basically.
Okay.
Okay. One last thing. Are you doing anything for neurologic support here for her? So I know I see you're on the Trifortify, which again is liposomal glutathione. Glutathione can repair injured cells from the inside. But additional things you may want to consider is that ATP360 I talked about earlier, or even the BPC 157 peptide as well too. So I would consider those things as well too.
Would that conflict with Mepron?
No, I would not see those as conflicting with Mepron.
Okay. For some reason I thought CoQ10.
Oh, I'm sorry. What am I thinking of? You're right. The ATP 360 you could not do because it's got coenzyme Q10 in it, and coenzyme Q10 will interfere with the functioning of Mepron. There is a phospholipid complex product, which is called NT factor, that does not have coenzyme Q10. I know Research Nutritionals has produced a product called NT Factor Energy. They're stopping. I think we may still have a supply of the product. Allergy Research Group has been making a powder that is just NT Factor. So you could see if you could find an NT Factor product. And again, I'm not quite sure right now whether we still have the Research Nutritionals product anymore because I know they're discontinuing it. I do believe Allergy Research has this product called NT Factor. It's a powder that is just pure NT Factor. It doesn't have coenzyme Q10 added in.
Okay, thank you for that.
Yeah,
Her doctor pulled her off of everything today.
yeah. I
She
can
thinks
understand. I mean, you start wondering, what are you doing exactly? So yeah.
Thank you.
Good luck, Jim. Good luck to your wife too. I'm sorry to hear about this. Yeah, yeah. Anyone else have any questions at all? All right, about that. So Jim, I'm just going to do a quick screen share here in case you do want to look into some of this a little bit more. The methylene blue. This is my article on methylene blue. Again, this is something you could, print off and bring to your doc to take a look at. And then in terms of approaches to Babesia and Bartonella, take a look under my infection treatment plan section here. And you've got my Bartonella guide right here. And you've got my Babesia guide here. Okay. All right. All right. Good luck. All right. Hello, Cindy. Let's see. Do you know if BPC 157 can help with gastritis and other inflammatory issues? Any concerns with taking it? My partner has severe gastritis and struggles to eat, sleep, bend over, etc. He can't stop losing weight, and I'm so worried about him. He also had Lyme, Babesia, has dysautonomia POTS, and is very sensitive to everything. All of your support is greatly appreciated. Wow, that's a lot going on there, Cindy. So BPC 157, again, is a peptide made in the stomach lining. And what I would say is my observations is I have seen it have more effect in terms of stomach issue, benefit-wise, downstream from the stomach, not necessarily at the stomach level. Okay, that's just been my observation, all right? Having said that, I can't say it would not work. Because again, it can repair injury throughout the gastrointestinal system. And if for some reason your partner just isn't making enough of it, it could contribute to inflammation within the gut lining. So if I were to try it with a patient in a similar situation, I might consider giving it about a 2-month trial and see if it made a difference. But if you're not seeing any benefit after a couple months, then I would probably consider just stopping it at that point. Okay. And then, the Lyme, not Babesia, but the Borrelia could be contributing some of that gastritis as well too. So I hope you're working with a Lyme literate specialist that can help you navigate through all that as well too. Okay. All right. Cindy, do you have any follow-up question there?
No, thank you very much for all of your support. Yeah.
Yeah.
And I guess if you have any other suggestions for gastritis, since that
Yeah.
goes down, if there something that's a great thing for things going up?
So one of the things, so first of all, I assume that with this severe gastritis coupled with weight loss, that somebody has scoped him, looked in his stomach. Am I correct in that? Yeah. And they probably have done a biopsy to make sure that it's not H. pylori. Am I correct in all that? Okay, yeah, all right. So one thing that, so a couple things. So the conventional docs, when it comes to gastritis, usually want to put you on acid blockers, right? Like your Prilisex and your Tagamets and all that stuff. But there's a subgroup of people that gastritis is actually caused by low acid. And so to help you figure out if that's the cause, you'd have to get him off his acid blockers. The trouble is when you come off your acid blockers, the body's going to react by making more acid. So you can make it worse. These drugs, these Prilisex, I mean, it's amazing what the pharmaceutical companies did there is they get people on these things is they're quite effective at lowering acid. But the brain doesn't like that. And the brain starts sending out a bunch of signals to overcome the Prilisex, right? And when you stop the Prilisex, all these cells in the stomach that produce acid are still being flooded with all these signals from the brain to make more acid. So you stop the stuff and you can't take it because you've got so much acid coming at you. It's like they made a medicine you get hooked on in a sense, right? That's my commentary, but anyhow, all right. But you would want to do a short-term stop. And then there's what's called an acid string test, where you put a string with a collection device into the food pipe, and you see, are they coughing up a bunch of acid into the stomach? And you can even measure acid levels in the stomach as well too. And if it's low, then you want to give acid. And the way you give stomach acid is there's something called betaine that you can take. If your conventional gastroenterologist is not aware of this, usually who is aware of these kind of conditions would be your functional medicine doctors. And so if you could find a functional medicine oriented physician that could help you consider whether to go on betaine just to see if that makes a difference. Okay. I know it's counterintuitive, but there is a subset of people that have all these gastritises that you would think are related to acid, and it's actually due to low acid. Okay. Second thing is I like working in these situations with sometimes what's beneficial is something called deglycerated licorice. And so their licorice has a chemical group on it called a glycyrrhiza group, and we remove it when we give it as a supplement because glycyrrhiza can cause your blood pressure to go up. So we take that chemical group off and we call it deglycerated licorice, also known as DGL. And if you chew tablets with DGL, your saliva and chemicals within the DGL mix together and create a microscopic gelatinous coat that covers the food pipe and also the stomach lining. And usually you'll have people chew 2 or 3 tablets three times a day before meals and even before bedtime. So 4 times a day. And sometimes doing it for a month that coating is enough to get things to heal up as well too, okay? In terms of the product that has that in it, let me just show it to you here and do a screen share. All right, so this is my store. And these are the 2 products made by Integrated Peptides. One it's called Rhizonate fructose-free and then regular Rhizonate, okay? So both of these have the deglycerated licorice in it, all right? All right. So Cindy, any other questions then on that?
No, thank you so much for your time.
Yeah, you're welcome. All right, let's see here. Hello, Chris. Let's see. Is injectable BPC 157 still the better way, even though it's just about impossible to find? Is there a close second in pill form you recommend? What is the best heavy metal test and how many metals should we really be looking for? Number 3, I tried your recommendation of ATP 360 with no real benefit. Any other suggestion for noticeable mitochondria support? Okay. All right. So first of all, yeah, I think injectable BPC 157, if you could get your hands on it, and that's the wild question, is probably stronger than doing the pill. The problem what's happened is the Food and Drug Administration regarding peptides, how peptides get regulated is that the Food and Drug Administration made a determination that it will regulate proteins as drugs, but anything that's designated as a peptide, which means, as you may know, peptides and proteins have the same building blocks. They're amino acids, okay? And the Food and Drug Administration artificially said if something has less than 40 amino acids or less, we'll call that a peptide. And anything longer than that, we're going to call a protein. We regulate proteins as drugs, okay? All right. So because they then said they're not going to regulate it as a drug, that means that it can be manufactured as supplements in a pill form. All right. But in terms of who makes BPC 157, therefore, because manufacturers aren't making it, it's compounding pharmacies. And compounding pharmacies have to follow rules of the FDA over how they produce things. All right. So the FDA, even though it wasn't, quote unquote, regulating peptides, it basically said for anything that's made in a compounding pharmacy facility, there has to be good evidence of efficacy and safety based on research. And a couple years ago, they said that we're going to allow peptides to be made for a while by compounding pharmacies, but we want to look at all the data. Send all your data to us. And so everybody sent the data to them, and they did not give a good analysis, even though the data is pretty strong that these things are safe and that they work. The FDA said, no, we do not accept that these are made in compounding pharmacies. And so therefore, pretty much across the board, we're now starting to lose the ability to get peptides out of compounding pharmacies. That's essentially what's happening. Okay. All right.
Mhm.
Unfortunately. So, okay. So having said that, then the next best thing would be oral peptides. The company Oops, somebody's got their microphone on. Okay, good. They turned it off. All right. So, of the product, one of the longest standing producers of oral peptides then is Integrated Peptides. And I think they've got good products from what I've seen. On the BPC 157 front, their spray that they have is short acting. They have a pill that is extended release, and then recently they came up with a short acting pill as well too. The short actings are probably better for acute sports injuries. The extended release pill, which is what I carry at my store, is probably better for long-term management of different conditions. Okay. All right. All right. And then so then let me go to your step number 3. So that ATP 360, the science is pretty good. It helps energy in about 54% of people, and it helps brain function about 50% of the time. That's their science. Okay, so it looks good, but that means it's 50% of people it doesn't seem to have much benefit on, right? So one of the things you can do to help mitochondria function is BPC 157 that seems to have some benefit. There also is an injectable peptide called MOTS-C, but it's becoming damn near impossible to get your hands on. And so, yeah, so the main thing I would still consider doing though is probably BPC 157. I would keep up with using liposomal glutathione, which helps lower oxidative damage. And then finally, you might consider doing a patch of your mitochondria function, and that's to use methylene blue. So let me just talk about that. All right. So your mitochondria, the structure of a mitochondria is basically an outer fat membrane, right? And the way that your cell fuel called ATP gets produced is that sugar and fat and proteins are broken down, and those chemical reactions create some ATP. But the other thing that they produce is a bunch of metabolites that have to then go through with something called the electron transport chain, which is these other metabolites have electrons taken off of them, and then those electrons are used in a process to produce the ATP. All right. This chain is susceptible to getting injured by oxidation agents, right? And there's 5 proteins in this chain complex. And if you get injury between 1 and 2 and 2 and 3, you don't get adequate electron transport. Methylene blue patches the injury between 1 and 2 and 2 and 3. Okay. So it's a patch. It doesn't repair the damage, but it does do a patch job. And usually, if it's going to work to help jumpstart your ATP production of mitochondria, you're going to know in about 2 to 3 weeks whether it's making a difference. So you could consider trying methylene blue at 25 milligrams twice a day. Probably is going to be enough for that kind of a function as well too. Okay, all right, and then let's see here, heavy metal testing. So what I like to do for heavy metal testing, I like doing it orally, and I like using an agent which is called DMSA, and you dose how much. It has to be given to you by compounding pharmacy. You basically, and you do a test. It's a 6-hour urine collection, and before you do the urine collection for heavy metals, and I use a lab called Doctor's Data that would analyze it. Is you take looking at you, you're probably going to be for 500 milligram DMSA pills, and you take those at time 0. Also at time 0, you pee out all the urine in your bladder. So you start from empty, basically. Okay. And then after you take your pills over 6 hours, you collect your urine. The DMSA acts as a metal magnet. So it's pulling heavy metals out of your cells into the bloodstream where they can be measured. That's what we're interested in. We're trying to get an idea of what's going on inside your cells. Okay. And so then over 6 hours, you do that. DMSA is a pretty broad spectrum binder. It's a little bit stronger for mercury and lead, but most people, that's their problems are going to be in mercury or lead anyhow, right? So, and it's a functional medicine doctor that can help you do that as well too. Okay.
Perfect.
All
Thank
right.
you. Appreciate the help.
Yeah, you're welcome.
Anyone have real quick?
Yeah.
Tongue-in-cheek kind of question. What would you think of the company Peptide Sciences for the actual injectable peptides?
Yeah. I honestly don't know.
Okay.
I'm not familiar with them. Yeah. Yeah.
All good.
All right. Good luck to you.
Thanks.
All right. Let me just see something here. Yeah, actually, I'm going to do a screen share here. I was have been preparing a talk on mitochondria that I'm going to be giving at the A4M conference, which is American Academy of Anti-Aging Medicine, which is really a functional medicine group. And I'm going to be giving that talk in about 4 weeks now, down in Palm Beach. But let me just show you a diagram that I'm using in that presentation, which will show you this electron transport chain. Let me see here, share. There we go. And get rid of that. Okay, so this is, get rid of that. Okay, so all these chemical reactions that I'm showing you here in the middle is basically a bunch of chemical reactions that break down fat, sugars, and proteins, okay? And the metabolites then get fed into this thing down at the bottom, which is the electron transport chain. And basically there's a protein complex 1 and 2, you got coenzyme Q10 in here, 3 and 4, and basically the NADH and FDH electrons are pulled off and they get moved into the bottom here. And where methylene blue works is at 1, 2, 3, and 4. It literally patches right across there, basically. Okay. All right. I'm not sure if that made it any clearer or confused it, but that's all right. Let me get out of here. Okay, let's move on. Oh, I see, Sandra, I see your hand up there.
Yes, a question about the methylene blue. You said
Yeah.
it only patches it.
Yeah.
I've been using 25 milligrams twice a day and then raised it to my doctor raised it to 50 twice a day. And it does help a lot with the energy.
Yeah.
But are you saying that that I have to be on this forever if I want to keep patching where the error is?
The big thing is you need to make sure if you're not let me see here. where did I go here? I got lost in my own screen. No, that's not it. Where are you? Here. Hold on a minute. I'm lost in my own computer. Where is everyone? There, go there. Oh, there we are. Okay, I got y'all back again. So the methylene blue is only going to provide a patch. Now, it is possible if you get better energy production in your mitochondria that eventually it will use that energy to heal itself. Okay, it's possible. But usually what I like to do while I'm patching the mitochondria, I like to go in and do a repair job on the mitochondria. And the repair job is again to use that ATP 360 product that I mentioned earlier that has the phospholipid fats that make up the mitochondrial membrane. And it also has CoQ10. It's got something called PQQ in it that increases mitochondrial mass. So that, along with liposomal glutathione, you use those two together to repair the injury. So, and that will get you a faster turnaround than just waiting for increased energy production by patching your mitochondria to fix the mitochondria, basically.
I am using the ATP 360
Yeah.
and I tried the glutathione, but I am apparently allergic to that. So I've been using NAC.
Okay. NAC is going to get you at the same idea, which is it will increase glutathione as well, too.
Okay. All right. Thank you.
You're welcome, Sandra. Thanks for the question. All right. Let's see here. Sheila says, hello. Hello, Sheila. All right. And let's see. Hi, Dr. Ross. When you stop low-dose naltrexone, do you do it gradually? I have been on 4.5 milligrams a day for a year. You know, I do. I have found when as you know, when you start at 1.5 milligrams a day for 2 weeks, and you go to 3 milligrams a day for 2 weeks, and then you hit 4.5 milligrams. I had at times with my patients tried to stop it quickly by literally having them going for 4.5 milligrams a day and then just stopping it. But there were a few people that I found got confusion and got agitation by doing that. And so what I tend to do now is I step off of it at the same way I went into it. So I would probably drop to 3 milligrams a day for about 2 weeks, then down to 1.5 milligrams a day for 2 weeks, and then stop it from there. That tends to be the way that I wind up doing it. Okay. All right. Any follow-up question on that by anyone? All right, let's keep going. Hello, Melissa. Let's see. Through 2.5 years of treatment, including a major psych BART relapse, my AM cortisol stayed high at 22.3 to 30.7. I followed your protocols, all other hormones normal except testosterone, intermittently elevated 55 to 89. PCOS rule out via ultrasound. Now all hormones are high. Luteal labs of DHEAS 243, estradiol 268, testosterone 55, progesterone 33.6. Thyroid levels okay, but I've been on 15 micrograms of liothyronine, which is T3, everyone, for clinical hypothyroidism. Goal was to discontinue, but I don't know when and why. I had debilitating fatigue. Now it's up and down, but often have high stressful adrenaline-driven energy with racing heart. It resembles my pre-Lyme high energy personality, but hard to separate from Bartonella-induced anxiety. I take ashwagandha, L-theanine, and rhodiola. Why are my hormones now high? Could this signal a temporary endocrine shift, overactive adrenals, or HPA axis dysregulation? Can you explain? Could long-term adaptogens contribute? Any recommended test or changes? I previously took spironolactone. Should I resume? Okay. So the spironolactone would have been done something to help with the PCOS. If you're getting symptomatic from the PCOS, you might want to consider that. In terms of looking at this, I am not sure why you're having this elevation in all of your hormone markers. I would be inclined in a situation like this, though, seeing this, I would be inclined to probably trying to come off the ashwagandha and coming off the rhodiola. Granted, their main effect is to stimulate the adrenals, but your DHEA is coming from the adrenals. The adrenals make precursors that become progesterone and testosterone. And so I would think about, because I can't figure out why exactly, I would want to remove, if you were my patient, I would probably remove anything that is hormone stimulating here, which would be your ashwagandha and the rhodiola, and then probably come back in about 2 months and retest again. That would be the approach that I would wind up going here. Melissa, did you have any follow-up on that?
Sure. Yes. So have you ever seen with your patients, like as they find healing, this is the first time I've made really significant progress in healing. And I
Yeah.
didn't know if my, hormones, adrenals had been suppressed for so long because of the
Yeah.
Lyme that now they're kind of just coming out and not knowing what to do.
Yeah, your system's working. It may be that literally your system is starting to turn on to do this itself, but now you've got, and on top of that, your system turning on, it's getting, um, it's getting poked at to even do more with the ashwagandha and the rhodiola. So yeah, I have seen that as people recover from tick-borne infections, that I no longer need to use the thyroid medicines and I no longer need to use the adrenal supports. I have not seen a picture like this of the DHEA, progesterone, estradiol, but I will be honest with you, in my practice, I didn't do much DHEA, progesterone, estradiol testing. So it could have been there. I just may not have known it. But if you are doing better, yeah, as you get better, you don't need all these supports, right? So it could be just an issue of you don't need the supports anymore. And if you pull those out, you're going to get better numbers, basically.
Okay. Do you have any indication or guidelines on when you might discontinue the liothyronine? Unfortunately, my doctor unexpectedly passed away,
Yeah.
and that was kind of on the next discussion table, and I don't know that aspect of
Yeah.
treatment.
What I would probably do here first is get off of the rhodiola and the ashwagandha. Come back and retest. If you're doing okay in about 2 months on everything else, then consider pulling back on the thyroid. That thyroid is not that high of a dose, actually. So you're
Sure.
okay doing that. You're not going to hurt yourself with that. And as you come off of it, your own thyroid gland will turn on and start producing it on its own as well, too.
Okay. Sounds good. Are there any other supplements or anything that might be contributing to this? Because of course I'm taking a bunch that I didn't mention, like off the cuff that you think of.
The only, the main supplements that people take would be they take DHEA. So if you're doing it, obviously come off of it. Your ashwagandha rhodiola, again, are both promoting adrenal and thyroid activity. So yeah, we come off of that. And again, adrenals feed into DHEA, progesterone production, even testosterone. So unless you're taking any other adrenal supports that you're not telling me about, I can't think of what else would do this.
Okay, sounds good. L-theanine's okay. That's an
Yeah.
amino, if I'm right. Okay, great.
You're fine
Thank
with
you
that.
so much for your help. Appreciate it.
I'm glad you're doing better overall. These are good questions to have. I mean, good problems to have, right? It's about
Oh,
time going
absolutely.
back on stuff. So yeah.
Yeah.
Good luck to you, Melissa.
Thank you.
Let's see, J. Rosedale, or JS Rosedale, I should say. I'm taking antibiotics for Babesia and Bartonella. Do I also need to take herbal medicines? So it depends. No, you don't necessarily. Well, let me rephrase that. If you're taking prescription antibiotics that at least 2 prescription antibiotics for Babesia and at least 2 that cover Bartonella, you should have, and I don't even know what you're taking. Okay, I'm just saying in theory. If you're doing 2 antibiotics for Bartonella, 2 for Babesia, you probably have adequate coverage in terms of germ killers, okay? If you are not taking 2 for each of those, then I would consider adding in herbal antimicrobials that target each of those germs. A simple one could be adding in Cryptolepis that happens to take care of Borrelia, Bartonella, and Babesia, okay? All right, so that's something to think about there. Okay, now, regarding the bigger question, and I don't think this is what you're asking, but I'm going to just say it. So to recover from chronic tick-borne illnesses, you need to do more than kill your germs. All right. You've got to address all the imbalances that those germs created. So, my Ross, Lyme, and tick-borne diseases support protocol talks about the need to get sleep and suggests things for sleep, the need to lower cytokines, and especially want to lower cytokines because they give you most of your symptoms, but they also suppress the immune system. So being on something to lower cytokines. If you have low energy, being on an adaptogen like an ashwagandha. So anyhow, the bigger thing is, if you're just talking, if your question is really just about antibiotics, I think I answered that. But I want to be clear, make sure you're doing all those other supports that are going to help you get better as well too. Okay.
Okay.
Yeah. Did that answer your question for you?
Yep. I'm on Mepron, Doxy, and Tefenequine
Yeah.
for the Babesia, and then I added the methylene blue for the Bartonella.
Yeah.
So
You're
yeah.
doing good. You're on a good
Okay.
treatment. Yeah.
All right.
I don't see any added advantage out of doing the herbs. The reason I tend to go with herbs, a lot of discussion here, is there's a lot of people that just don't have doctors that are helping them. So it's the herbs that they have access to. But the other thing is, I tend these days, even in my practice before I stopped, I tended to be working more with herbal antibiotics. And the reason is they tend to cause less disruption to the intestinal microbiome. And, more and more, we're starting to see the research is proving to us the value of keeping your intestinal microbiome healthy. Because keep in mind, I call the intestinal microbiome the brain of everything. It's the brain of your immune system. It's the brain of your brain. It's the brain of your mental health system. Chemicals made by your healthy microbiome literally direct every system in the body. So I tend these days, especially if somebody's not on things already, I tend to navigate them more towards the herbal antibiotics and herbal antimicrobials to see if they'll work well enough while sparing the gut, basically. Okay.
Mhm.
Yeah.
But if you completed your antibiotic treatment, would you follow up with the herbal medicines just to
Yeah.
keep on a protocol?
Well, that's a good question. So what it raises the question of is when you get well, whatever well is, well may mean 100%, well may mean 80%, but you're really taking on life and you're not getting any further improvement. Because part of the problem with these tick-borne infections, maybe they create permanent injury, right? But whatever well is, it's possible that you actually eradicate all the germs, right? The trouble is, you may not have eradicated all the germs, and we don't have testing that proves to us that the germs are gone. Now, there is a consensus among most Lyme literate medical doctors. We had this whole discussion maybe about 2 or 3 years ago in one of my Lyme discussion boards about when do doctors think that somebody's cured. And there was general consensus that if somebody does not relapse by 2 years, we never see them relapse again. So 2 years of not having a decline probably means you're cured. All right. I hope you heard the word probably. I can't say definitively, but probably. Okay. So what I do in my treatments, what I would do with my patients when it came time to stop, and my guidelines of when I'd stop would be either somebody's 100% well or I've done tons of things to get them moving forward. And no matter what I do, we just can't get them above their 70 or 80%. And I do that for about 4 months. And at that point, I'll decide it's time to stop too. Okay. And I give them a choice. So I'd say, there may be that we've knocked all your germs out. What we could do is do things to support your immune system by having you get sleep, exercise to tolerance, being on an immune booster like a transfer factor multi-immune from research nutritionals, but doing things that support the immune system, eating a healthy diet, okay? And let's just see what happens. And if you do start to decline, get back in here right away. We'll get you back under treatment and turn you around again, okay? Or the other option we could do is put you on herbal antimicrobials to suppress the germs from popping back up. Often my preference would be that somebody at least tries once to stop their herbal antibiotics. I have found, or prescription or herbals, I have found if somebody does start to relapse, it's a quick turnaround once you get back on things. It's not going all the way back into the hole again. Okay. All right. But if I do get somebody that has relapsed or they do want to be on things to prevent a relapse, a general rule of thumb would be to be on herbal antibiotics to do, or antimicrobials to do that, but dose them at about 1/2 a treatment dose. In other words, if I used Cripolepis to manage their Bartonella, their Borrelia, and their Babesia, a full dose on Babesia would have been a teaspoon 3 times a day. I dose Crypto higher for Babesia than I do Bartonella and Borrelia. Bartonella, Borrelia, I dose it at a 1/2 teaspoon 3 times a day. But if you're using that as your one thing to kind of swat your germs down, the big three, then I would probably do a 1/2 a teaspoon 3 times a day to help prevent. Okay. I also talk about possibly using cat's claw and Otoba bark as something you could use to suppress Borrelia. And instead of doing 30 drops twice a day on those, I would do 15 drops twice a day on those. Okay. All right. Does that answer your question?
Mm-hmm.
Yeah.
Okay.
Yeah, let me show you, because if you want to look at this a little bit more, there actually is a whole article I wrote about how do you determine you're done and then what do you do basically. And let's see, where did that go? Here we go. All right, so if we take a look, this article called Finished and How to Prevent Relapse. I talk about how do you know if it's cured, but then down here I talk about preventive herbal antibiotics if you want to do it, okay? And then the other thing somewhere up here, I talk about the need to rehab the intestinal microbiome. Anyhow, you can, and then do things to boost the immune system, which is get sleep, regular exercise, do emotional detoxes, eat a plant-forward diet, be on a good multivitamin, consider doing transfer factors or being on mushrooms. Okay, those are the things that I recommend here. Okay, all right. All right, thanks for that question.
Thank you.
Yeah, Melissa, I see your
You
hand up.
mentioned the 2-year time frame about the relapse. So I also just mentioned that I just had a really significant relapse. So is that kind of an indicator for the future that I will be more likely to relapse, or does it restart when you're treating?
So in that kind of a situation, if you do get into at least one relapse, when I stop the herbal or prescription antibiotics again, I would leave you on something to suppress at least for 2 years the germs coming back again. Okay. Now I will tell you there's a group of people that when we get them well, and again, well may mean 70%, it may mean 100%, but when we get them well, what we're going to wind up doing over time, there's a group of people that basically we reintroduce herbal or prescription antibiotics periodically to knock the germ load down. And then they're back on their way again. And periodically we just come back and do it again. Okay. There also are people that were in my practice that we would do that. But in the end, we just found it easier just to leave them on something to suppress their germs. Kind of like, it's not a direct analogy, but it's an analogy. You know, in chronic HIV management nowadays, we leave people on virus killers indefinitely. And we don't think twice about it. We just do it because that is a chronic infection that in most people, 99.9% of people, we cannot eradicate with our antivirals. And there is a smaller subset of people with chronic tick-borne infections that with all the antibiotics we do, herbal prescription, we can't eradicate. And maybe we just need to leave them like we do in HIV on something to suppress the germ load so they can live full lives, basically.
Okay, do you think if Bartonella is particularly the culprit there, would you do Cripolepis and Japanese knotwood or the Sida acuta and Houttenia? What do you recommend? Or all 4 of them?
You know, it's a good question. So I have found historically, I have found using Houttenia and Sida acuta to be very effective at suppressing. Okay. Having said that, you know, Cryptolepis, Japanese knotweed for Bartonella, those are kind of newer ideas for many of us based on newer research that came out supporting them over the last 4 or 5 years. And I gotta tell you, clinically, I think the crypto and the Japanese knotweed are stronger than Sida acuta and Houttenia. Clinically, I think they are. So, although most of my experience has been suppressing with Sida acuta and Houttenia, I think these days, I haven't practiced coming up on almost 2 years since I left clinical practice. I think these days, I would probably be going more in a cryptolepis Japanese knotweed direction. I think they just, as I was leaving practice and I was working with those as germ killers, I found them to be more potent actually.
Okay. And overkill to be on all four, or?
It's a good question. The only problem, again, the more things you're on, the more possible disruption you do to your gut microbiome.
Mm.
And so we have to keep that in mind because if your gut microbiome gets disturbed, then you have immune suppression, you have less help regulating the immune system, and you start losing the help of your immune system to help you too. So I tend to take more of a less that controls is best rather than more is best approach when it comes to using your antimicrobials long term.
Okay, sounds good. Thank you so much.
Yeah. All right. Thanks, Melissa. All right. Hello, Tammy. Let's see. Slightly elevated enzymes in 2020 along with flu-like symptoms. IGeneX test in August 24 shows Babesia, BART, and anaplasma indecisive. April 23rd went to Puerto Rico, bad rash on chest and back with fever, flu-like symptoms. November 23rd, really sick. Flu-like symptoms, low white blood cells, starting seeing bubbles in urine along with sediment, microscope traces of blood. Many labs and images found nothing. April 24th, still have bubbles, no traces of blood, but now slightly high urine protein creatinine, along with low white blood cells, neutrophils, and slightly high lymphocytes. Trying to understand if this is Lyme or possible tropical parasites. What possible treatment? Thank you. Boy, Tammy, I honestly don't know. I don't know. I would need to see what labs you've written down a number of things here, but you've written down, labs here. From what you've said here, and I'm not going to have time to do a full visit to tease this out with you here right now. I honestly don't know how to advise you here, unfortunately.
Thank you.
Yeah, you're welcome.
Can I ask, do you
Yeah.
ever see Lyme in the bladder?
No, good question. I don't tend to see kidney injury, which is kind of what you're describing here with the protein and creatinine going up. That suggests the kidneys are being affected. I don't tend to see that with tick-borne infections.
Okay. Okay, thank you.
All right, good luck to you.
Thanks.
Melissa, I see your hand up there.
I'm so sorry to ask another question. Just while you're on the bladder. So my mother-in-law actually was just also diagnosed with Lyme, and she has problems, I guess, emptying her bladder. And I have not heard of that being a symptom of Lyme, and she was trying to sort out if that could be related or not.
So Borrelia and Bartonella can affect the nerves that make the muscles in the bladder squeeze things out. Okay, so possibly, I wouldn't consider that a normal effect, but it's possible. All right.
Okay.
The other thing that can happen that's more common with Bartonella and Borrelia is they can lead to inflammation of the lining of the bladder. And that leads to bladder irritability and frequent urination. And that is a condition called interstitial cystitis. Usually, getting your infections under control will help that resolve. Also, being on quercetin will lower some of that inflammation in the bladder wall. And then being on glucosamine sulfate will, the glucosamine sulfate is broken down and creates a microscopic gelatinous coat in the bladder lining so that your urine doesn't keep inflaming this inflamed bladder wall. Okay. And so you could either do it as quercetin 500 milligrams 3 times a day with glucosamine sulfate 500 milligrams 3 times a day, or there is a product sold by Vitanica, which I carry at my store. It's called Bladder Ease. And it's a combination of quercetin, glucosamine sulfate. It's got some arginine in it too. And you would do 3 pills 4 times a day of that. Either one of those is an option that you could look at, try and see if it makes a difference, basically.
Okay, thanks.
Yeah, good luck. Zoom user, who is this? I see your hand up there.
Hi, Marty. It's Tracy.
I figured you're the.
Yeah.
Yeah.
I have not figured out how to make it identify me. It used to and then stopped, and it has its own brain. So, two things. One is, so are you saying then that Lyme is an agent that gets into the bladder and creates IC?
So yes, but usually we tend to think it's more Bartonella that's doing it, but I have seen it occur with Borrelia.
I see. Okay.
Yeah.
And then my second question is technical. I'm not seeing any of these questions that you've answered in my thread. Is that because people are writing to you, not on the write to everyone, but write to you alone thread?
No, they've been writing to everyone. Are you on a phone?
I'm on an iPad.
I wonder if for some reason it's not showing there, because I mean, are you able to click on the chat function there and see if anything pops up?
Yes, there's a ton of questions, and I was able to enter mine, but the
Yeah.
very first, but I haven't, any of the ones you're reading, I haven't seen. So
Wow, because that's interesting. Oh, well, let's see. I see a lot of these, it appears, have been written to everyone, so they should be showing up there.
I
It's
believe you
weird.
can't see any of the questions that were posted after you joined the Zoom chat, so it's possible you only joined the Zoom after those were posted.
Okay. Did you hear that?
Oh, wait, you mean I can't see any of the ones that were posted before I joined?
Right.
Correct.
That's probably the problem. Great. That makes sense. Thank you.
Okay. Ronak, thank you. I appreciate that input there. All right. Let's see here. Let's see. Jay Rosedale writes, when do you know if you are done with the Babesia treatment? So, on average, for 85% of people, a Babesia treatment requires about 5 months of treatment. Okay. The reason we treat that long is Babesia lives inside your red blood cells. A life cycle of red blood cells, once they're hatched out of your bone marrow, is about 3 to 4 months. And we find the most effectiveness of bathing your bone marrow with Babesia germ killers for at least one whole life cycle plus 1 month more. That seems to work best to get rid of Babesia. Okay, now the other thing you're looking at and deciding if you're done with the Babesia, because again, there's 15% of people that it's not a 5-month treatment. It takes longer, and maybe a lot of that is because it's Babesia oticoli. We now understand oticoli is a lot harder to treat than other Babesia strains, because oticoli has the ability to sequester or hide itself inside your blood clotting fibrin. It'll mix itself up in the fibrin blood clotting protein and hide itself, if you will, from the immune system. Okay. And that may take a year, 2 years sometimes. It can be a longer strain to get under control. You've got to use lumbar kinase for that one. But you're looking at symptoms, and you're looking to see if there are symptoms that suggest whether it's still present or not. So symptoms that can indicate Babesia is still present are air hunger. I will also let you know air hunger can be seen in Bartonella too. Okay, but air hunger is one, which is a feeling you can't get air from time to time, even without activity. Okay, night sweats, headaches, frontal headaches especially, and migraines can be part of Babesia. Some people with Babesia have an interesting symptom that really is a useful one to track, which is some people with Babesia get frequent deja vu experiences. And I have found that frequency of deja vu experience to be a very accurate indicator in those people of when we're done with Babesia, because it goes away. These are people that will have deja vu at least once a day or more, sometimes once a week or more, but more frequently than me, that I have it maybe once every year, right? I mean, it's very frequent that they'll get it. The other key thing that can make you think of Babesia is also just severe fatigue that is much worse than out of proportion fatigue compared to everything else that's impaired with your illness as well too. Okay.
Yeah, I've been treating it for about 5 months, and
Yeah.
my symptoms have pretty much gone away. I only have symptoms when I take the tafenoquine,
Yeah.
either like the first few days or like, at the end when I'm due for my next dose.
So you're still having probably a Herx reaction from killing Babesia.
Right. Yeah.
Yeah, I would keep probably going until you're not having that anymore.
Okay.
Yeah. And also I would look at getting on some lumber kinase in there too.
Okay.
Do you know
Thanks.
why I want the lumber kinase?
Oh yeah. Mhm.
Okay, all right.
Yeah.
So yeah, and that's just because it could be it's Ota coli, especially if it's not all the way wiped out by 5 months. You've got to wonder if it's Ota coli, and Ota coli will hide itself in all the fibrin. So you want to break down the fibrin so your tafenoquine, your immune system can get in there better. Okay.
Okay. Alrighty. Thanks.
Yep. Good luck.
Bye.
All right. Let's see here. Hello, it's a dog's world. Now I know I should know who you are, but I'm blanking right now. Okay, well, I'll let you tell me who you are here in a minute. But let's see. Hi, Dr. Marty. Thank you for all you do. Number one, I've had Lyme for 10 years. I'm about 90% give or take. Is it okay to keep taking herbals such as cat's called cryptolepis to keep things at bay? When I stop, I start feeling off. Number two, is it okay to get the shingles vax while on methylene blue? All right, so I think we kind of talked about earlier in the webinar about herbal antibiotics to prevent. And I would say, yes, if you keep coming off and you get more symptomatic, I probably would just stay on herbal antibiotics like a cat's con, cryptolepis. Find a dose, though, that maintains you. You may not need to do full strength. You may be able to cut the dosing down to the half normal strength to maintain that for you, okay? And then in terms of the shingles vax and methylene blue, I have no problem with that. Regarding shingles vaccine, again, the reason to do it is in people, I think they're now saying over 50, but I think that's a little premature, but over 60, we start developing immune systems over time that decline in their ability to control the chickenpox virus that many of us have in us because we got chickenpox as a kid. And over time, as our immune system declines in its ability to control the chickenpox virus, it can break through as shingles. And when we're older, it can create chronic pain syndromes that don't go away and actually can create an illness that it'd be really sick. It does appear the shingles vaccine does work quite well. I am not hearing reports of people being harmed by the shingles vaccine. So this is one that I do recommend getting. And I don't see a reason that you would be impaired, or that it would hurt being on methylene blue to do that. Okay. All right. Any further question on that one?
Hi there. No, you answered my questions. Thank you. This is Karen.
Oh, that's right. I was going to say it's got to be Karen, but okay. What kind of dogs do you train, by the way?
Oh, I train everything. Every dog.
That's good. That's good. All right. So it's interesting, I have two Basenjis, right? Or I had two Basenjis, they're back there, but they both died last year. So I decided I was missing dog energy. I just love dog energy. I'm still mourning my Basenjis, but I wasn't acting out of like mourning. It was more like I just miss dog energy. So I decided this time to do a rescue from the pound. Oh boy.
Yeah. Well,
you know what? He's doing great though. So his name is Blue.
uh,
So Blue is it was raised by hoarders for 4 years. That says a lot right there. But he became extremely leash reactive, etc. But I gotta tell you, I call it drugging him with food cocaine, going out and using the food. Whenever I see a dog, I try to treat him. You know the routine. I mean, I treat him before he reacts, so he starts associating dog with food. He's like a new dog, and this is just in 2 months. I'm starting to enjoy my walks with him. So
yeah. He's a dog trainer.
he's a good, yeah. And yeah, I'm glad you do the work you do. So yeah.
Okay. Thank you so much.
All right. Let me see. Hey, Blue, do you want to say hi to people? No, you don't want to say hi to people. All right. Let's move on here. Hello, Mary. Let's see. Hi, Dr. Ross. I saw a piece recently about hypercoagulation and Lyme disease by Todd Medeiros. If you have seen this piece, what is your opinion on it? I haven't seen that piece. Okay. What I can tell you, we've long known that chronic infections of any kind, tick-borne, you name it, one of the things it does is it stimulates a greater production of fibrin. And so I call that sticky blood. You just get a lot of extra fibrin within the blood, and that can lead to hypercoagulation. I'm not sure if that's what Dr. Medeiros wrote about, but there used to be a testing we all used to do to see whether there was too much of a fibrin within the blood. Most of us don't do it now, but being on a lumbar kinase is a way to approach that. Being on heparin is another way to approach that as well too. So I don't know if I answered your question entirely. I haven't seen that specific piece though. Mary, are you still there at all? All right.
Yes, Dr. Ross, thank you.
Yeah, did that answer your question for you?
Yes, it did. I just came across that piece recently, so I was wondering what you thought.
Yeah. Is it a piece about increased fibrin as a part of inflammation then? Is that what he's talking about?
Yes. Yes.
Yeah. That's been it's a long time understanding that we have. So that doesn't surprise me he wrote that then. Yeah.
Okay. Thank you.
You're welcome.
Yes.
Jim, I see your hand up there.
Hi.
Hi.
Yes. Hi. I just had a very quick question.
Sure.
Going back to the shingles question.
Yeah.
Does having had an episode of shingles confer any immunity?
Oh. I honestly don't know. I don't know. I'm going to have to leave you with that. That is something, if you were asking me as a patient, I would tell you, let me look it up and I'll get back to you tomorrow. But I just honestly don't know off the top of my head, Jim.
Okay. Yeah. You know, I when I was about 40, I had a quite mild episode of it. And I'm 76 now.
Yeah.
And I haven't taken the vaccine, but I've been planning to.
Yeah.
And the question just came up for me as I was listening tonight.
It's a good question. I just don't know.
Okay. Thanks.
You're welcome. Let's see. Sandra, I see your hand up there.
Yes, on the shingles vaccine. I had that vaccine about 10 years ago at the age of 59, and it was one shot.
Yeah.
Should I get another? I understand it has 2 shots now.
Yeah.
Do
So
I need to?
there's a newer vaccine out called the Shingrix vaccine that I do not believe was out there 10 years ago. And it seems to be more effective than the previous way of doing it. So this falls in the realm of primary care stuff, and I haven't kept up on the literature as to whether they're recommending for people that had the old shingles vaccine to get the Shingrix now. I honestly don't know. You ought to talk with your primary care doctor and see what they have to say.
All right, thank you.
All right. Jackie, I see your hand there. Jackie, are you still there? All right. Jackie, you're still muted if you're trying to say so. Oh, I see your hand is down. Okay. All right. Let me move on here. Hi, Melissa. Let's see. I have Bartonella cantana and Henselae and have been tracking my symptoms. I consistently have a flare every 5, sometimes 6 days. On day 5, I experienced significant neuropsychiatric symptoms, pain, inflammation, etc., which improve over the next 4 days. I feel best with peak energy, mental clarity, and well-being on day 4, right before the bacterial burst, at which point the cycle restarts. The cycle was less obvious earlier in the treatment. I recently learned that Bartonella cantana has a 5-day replication cycle inside epithelial cells. After synchronized replication, infected host cells burst open, releasing a large number of bacteria. This bursting can cause a peak of bacterial load, which likely coincides with the symptoms. Have you observed this pattern in your BART patients? I've started increasing my anti-cytokine inflammation supplements on day 4. Do you have any additional suggestions to improve treatment? or alleviate symptoms during the cycle. So that's interesting. You know, I haven't seen that before, Melissa. Historically, most of us know that treat tick-borne infections know that Borrelia will have about a 3 to 4 week cycle of worsening. It's very common in Borrelia that people get a worsening about every 3 to 4 weeks related to the Borrelia growth cycle. I had not seen that happen with Bartonella, so that I think that's interesting that you found that. The main thing I would make sure of with your Bartonella, and that is that there are some practitioners out there that try to pulse dose Bartonella treatment, and I don't agree with it. I find better results by being on continuous antimicrobials for Bartonella. So if you're not doing continuous, I would definitely look at that. If you have been doing continuous, your idea of bumping up your anti-cytokine agents seems like a decent one to me. All right.
Sounds good. Thank you.
All right. All right. So Dawn, I know you have a question about SOT. I think you've read my article, and all I'm going to say is I'm not a believer in SOT. And we're out of time here now. So I don't know whether it leads to more inflammation the way the mRNA vaccines do or not. What I am surprised by is all those doctors out there that have been against the COVID vaccine, mRNA vaccines, seem to be a number of those doctors that are now promoting SOT, which is injecting you full of RNA. I don't get it, but that's what they're doing. So for those of you that don't know what I'm talking about SOT, just go to my Lyme information site, write in SOT. You'll find a whole article I wrote about it. It's one of those new darling treatments that has no scientific foundation behind it, and practitioners are charging thousands of dollars per treatment. Yeah, that's what I'll leave you with that thought. Okay. All right. So tomorrow morning, I will get the recording out to you in an edited format that will have a summary of what we talked about. When I post that tomorrow, also we'll put the link up for our next webinar, which again is going to be in 2 weeks. I apologize, everyone. I'm in a period of going and doing meetings where I'm talking, and so I'm not here as much. And that's going to continue through April. But at the end of April, I'll be back here. We'll probably be doing regular weekly webinars again. Okay? All right. Good night, everyone.